When the government closes their door and turns their back on the nursing profession, they turn their back on patients. And that's what's happened here today. I've made every attempt to get into a room with Stephen Barclay and to talk about nurses' pay and to try and have those issues addressed for our nurses. And he has refused to do that. He's brought me into rooms and talked about anything else but nurses' pay. He has closed his books and he has walked away and not put one extra brown penny on the table for these brilliant nurses. Personally, I have no issues with Stephen Barclay. I don't know the man. I'm here to do business with him on behalf of our profession, the 320,000 nurses that give me my mandate for today. That's a powerful, powerful mandate. It's their voice that I'm bringing into that table. It's their voice I'm asking him to listen to. If he doesn't want to negotiate with me personally, then let's do it through conciliation and with ACAS. They're ready and waiting to do that as well. But he must start to talk to me on behalf of those 320,000 nurses. This is a government that knows the cost of everything and the value of nothing. And when you think about that, let's think about that. Can you put a cost on what you see here today? The people that are in this hospital and deserve the best possible care that they cannot get because of 50,000 vacant nursing posts. They deserve better. It's up to this government. They have a responsibility to actually address those 50,000 vacant nursing posts and stop the drain out of our profession. How are they going to do that? They need to do that by paying the nurses a decent wage. They are not being greedy. They are asking for the 20% that has been taken out of their pay over the last decade to be put back in and to make sure that they can continue and care for their patients. I woke up this morning very, very early and I felt totally heartbroken as a nurse. First of all, and tragic that I have to lead my wonderful profession onto picket lines to have their voice heard. And I think that's a serious indictment on this government. It's tragic for nursing. It's tragic for patients and it's tragic for the NHS that the government feels that they can sit in their offices today and keep our nurses out in the cold. I've just said 20% taken out of their pay in the last decade. We're asking for it to be put back in. Pure and simple, if we are trying to address those vacancies and make sure that we can care for our patients, it is absolutely not too much to ask for. It's absolutely clear that safe care is compromised every single solitary day within our health system. And the people that are keeping our patients safe are those nurses that are trying every single day and every single night to do their utmost for our patients. Nursing is a safety critical profession. They are highly expert, highly educated, and they do everything they can with a depleted workforce. But today is about saying enough is enough. It's this government now needs to sit up, take stock and listen to us. Otherwise, I fear where the health service is going. I would say I'm very, very sorry. I'm so sorry, actually. We have worked now with employers for weeks to make sure that urgent and emergency care continues on a day of strike. And to make sure that there's no additional risk caused to patients as a consequence of nurses having their voice today. And we have exempted numbers of services. Services will continue on today. As many nurses that are on strike action today, there's as many nurses back in the services continuing to care for their patients. So we have taken a very steady, safe approach to this strike. It's not a massive walkout. It's not about nurses turning their backs on patients. We've worked through service after service and made sure that our patients continue to be cared for today. However, for those patients that have had their care cancelled today, it is for the employers to make sure that that is rearranged very, very quickly, and we will work with them to make sure that that happens. I would like the government, why don't they come out here today and stand amongst these great nurses and hear their stories if they don't want to listen to me and the voice they've given me, and listen to them, what they say loud and clear. Please listen to us. We don't want to have to leave the health service to go and work in retail or supermarkets to earn a few extra pounds. We just want to be able to feed our families. We want to be able to pay our bills. We want to be able to pay for our buses and our trains to come to our work. I don't think that's much to ask. I want to say thank you to every single nurse today. Those continuing to work, those standing out on picket lines losing a day's pay. We will continue to stand right by your side and make sure the decent thing's done by you.